Good afternoon, everyone, at least everyone who's on the East Coast. I'm Mark McClellan. I'm the director of the Duke Margolis Center for Health Policy, and I'd like to welcome you to today's virtual symposium on school-located vaccination strategies to increase child and adolescent immunization rates during the COVID-19 pandemic. We're very pleased to bring together an outstanding group of leaders in education and public health, people who are on the front line, researchers who are involved in these issues, public and private officials. We hope that this can be a critical and timely discussion on how to protect children and adolescents from COVID-19 and vaccine preventable diseases and consequences as they return to in-person learning this fall. It's been a challenging and unusual back to school season this year, to say the least. And I know many of you all have been working around the clock to ensure that students can learn and grow in safe, in-person learning environments. We want to thank you for that hard work and also provide a moment to reflect on what we've learned during the last months of COVID-19 vaccine distribution and where we need to go to ensure that all children and adolescents are well protected from all vaccine preventable diseases. We're making progress in vaccinating our young people against COVID-19, with just over half now of all adolescents aged 12 to 17 fully vaccinated. But we're going to need to continue these efforts and prepare for vaccination for potentially children age 5 to 11. Vaccines that could be authorized within the next month. We also know that there's been a significant drop in vaccination for routine childhood immunizations, along with well child visits during the pandemic. We haven't caught up with that yet, so we need to catch up on those routine vaccinations, ensure that every student has an opportunity to receive a flu shot this fall for a season that may be worse, in addition to dealing with the challenges around COVID vaccination. So put that all together, that's a lot in terms of vaccination strategies and challenges for the fall, made more pronounced by the many challenges that public health and school officials are having to face in responding to the pandemic and creating a more multi-factor and comprehensive approach to protecting children. So we're here today because we believe that school-located vaccination is a critical and proven tool for building vaccine confidence, expanding access to vaccines for those who need it most, and addressing these critical challenges. But we're also here today because we know that schools can't do this alone, and that it will take partnership and coordination between state and local public health officials, superintendents, school boards, school nurses, pediatricians, and the entire immunization community to make these vaccination clinics work. To support you in these efforts, we hope that we can bring stakeholders together now for a frank, up-to-date, and insightful discussion about innovative models and best practices, and work through some of those very difficult challenges that you're experiencing related to school-located vaccination. So go on to the next slide. I've given a little bit of an overview of why we're here and who I am. Our symposium co-sponsors include our group, the Duke Margolis Center for Health Policy. We're very pleased to partner in this effort with the Association of Immunization Managers, who just have tremendous experience on innovative approaches to school vaccination, and the Rockefeller Foundation, which has been there from the start of the pandemic to help with addressing these unmet needs. So on to the next slide, just a quick review of the agenda. I'm going to shortly turn things over to Claire Hannon from the Association of Immunization Managers and Bruce Gellen from the Rockefeller Foundation now. We'll be providing some opening remarks on the challenges and opportunities lying ahead for public health and education officials in this space. Next, we're going to be joined by Dr. Rachel Levine, Assistant Secretary for Health in the Department of Health and Human Services, and Mary Wall, Senior Policy Advisor for the White House COVID-19 response team, as well as Dr. Tara Vogt, from the Immunization Services Division at the CDC. They'll provide an overview of critical data on gaps in childhood immunizations and discuss how the federal government is working to support vaccination in school settings. After that, I'm going to moderate a discussion highlighting innovative strategies and key considerations for hosting COVID-19 vaccination clinics in the K-12 school setting. Next, Claire Hannon is going to moderate a discussion on strategies and considerations for leveraging school-located vaccine clinics to improve routine childhood immunization rates. Again, they've lagged during the pandemic, and also to prepare for and be ahead of the coming influenza season. Then LJ Tan, the Chief Strategy Officer of the Immunization Action Coalition, will moderate a discussion on current research on parental vaccine attitudes and beliefs, as well as strategies for engaging families and building vaccine confidence. And I'm going to provide some closing remarks to wrap up our discussion at the end. So got a lot to get through. We're looking forward to a dynamic discussion. We encourage you at any point to use the Q&A function on Zoom to submit questions to our speakers and panelists. We're going to try to incorporate as many of those as we can. You can also use Q&A to make comments and share resources with our team and colleagues gathered here today. Hearing and learning from all of you about the work that you're doing, the challenges, the particular challenges that you're facing, how you're overcoming them is going to be critical to adding to our ability to take on these challenges in the fall. And then last, we're also going to have a survey opportunity after the close of the event. We're going to ask for more information from you on how we can best support you in these efforts. This is not the last step in the work that we're doing on this important topic. And finally, would like to let you know that we're going to have a recording available of today's webinar on our website for those who couldn't join in person. So to the next slide, to help set the stage, I want to provide a brief update on national trends and key issues for preventing COVID-19 outbreaks in school settings. As this slide shows, and as you all well know, we're seeing a big surge in COVID cases, hospitalizations, and deaths as the highly transmissible Delta variant continues to spread. And in particular, this wave is disproportionately impacting children and adolescents as we've seen more vaccinations and more immunity in the older age groups. In the past week alone, over 240,000 reported cases have occurred in children. There are likely several times that many more cases occurring in children, often with none or minimal symptoms, but still contributing to spread, still something we'd like to avoid. And right now, over 340 children per day are being hospitalized with COVID-19 in conjunction with this surge. On the next slide, the good news is we know how to deal with this. We have safe and effective vaccines. We have a number of other steps that can provide a multifactorial response and protection, since any one of these layers is not perfect. So vaccines clearly most important for those who are eligible, where the vaccines are safe and effective, people 12 and over. The most important thing we can do to contain spread in schools and community and protect against the consequences of COVID-19 is to help more people who are vaccine eligible get vaccinated. As I've said, we've got a ways to go in getting those rates up. Many schools are starting to require vaccinations, not only for their faculty and staff, but even for students, accommodating exemptions. Most other districts are strongly encouraging and trying to support vaccination. Along with that, there are a set of other tools that can add protection. They're on this slide. So masks proven quite effective. Regular testing strategy that more and more schools are using, since there's so much asymptomatic spread, and inexpensive tests where we've had a lot of experience are now much more widely available. Changes in ventilation to reduce the airborne transmission of COVID-19. All of these things can help reduce risk, and they're particularly important in settings, these other steps besides vaccinations, in settings involving kids under 12 who can't get vaccinated yet. On the next slide, we also know that schools have a really important and trusted role to play in communicating with parents about issues like vaccines and other steps to protect children. There's a lot going on in this slide, but I want to highlight these recent polls from the Kaiser Family Family Foundation, showing the importance of school communications. Parents' vaccination intentions for their children are largely correlated with their own vaccination status, with 6 in 10 parents who have received the vaccine saying that their 12 to 17-year-old is vaccinated, comparing to just 4%. That's 60% versus 4% for the unvaccinated parents. However, while a parent's own vaccination status is a good predictor of their intentions to vaccinate their children, we know that school actions can make a substantial difference. Parents whose children's schools provided information or encouraged vaccination are more likely to say their child is vaccinated, even after controlling for lots of other things, demographic characteristics, party identification, et cetera, that may urbanicity, that may also be associated with attitudes on vaccination. So again, a reminder that we need to do all we can to support schools as both an access point and a source of information on vaccines. So next slide. I want to share some of the resources that we've developed to help support school-located vaccination efforts. The Duke Margolis Center for Health Policy, along with our partners at the COVID Collaborative and a number of education organizations, recently released this resource and issue brief that highlights innovative strategies for leveraging schools as COVID-19 vaccination sites. This brief also includes some case examples of innovative district-level approaches for engaging families, increasing access. We'll talk about some of these today. Please use this resource to provide some additional examples and guidance for you on what's going on around the country that can help address these challenges. So with that introduction, again, great to be with all of you. And I would like now to turn to Claire Hannon.
Thank you so much, Mark. And thank you to the event coordinators for this event. It's been amazing. We're just thrilled to participate. I'm Claire Hannon, Executive Director of the Association of Immunization Managers. And if you want to go to the next slide, a welcome from AIM. We are a nonprofit. We represent the 64 immunization programs that receive federal funding from CDC. It's 50 states, 6 large cities, and 8 territories or federated states. Our members work with all of you, all the stakeholders in communities, administering our nation's childhood and adult immunization programs, including COVID-19 vaccines. We work with vaccine planning, distribution, administration, tracking, all the routine activities, vaccine education, communication, safety monitoring, really representing the immunization infrastructure across the country. And Mark mentioned, the surge in cases in children, the Delta variant kind of setting the stage for today, but I just do want to celebrate our success in what we have accomplished. And 210 million Americans 12 years and older have received at least 1 dose, basically through this pandemic COVID vaccination infrastructure that we have set up. And we know that the next frontier, getting boosters and then getting children, younger children, is going to involve schools. Both parents and children have that connection through schools. And so we can use that to get more people vaccinated. Next slide. So why is AIM involved in advocating for school-located vaccine clinics? Well, immunization programs, again, are all through that immunization infrastructure, getting vaccines out. And school-located vaccine clinics have been a big part of this infrastructure and have evolved over time to be a great tool in the toolbox of public health to get vaccination rates up. We know that school-located vaccine clinics can increase vaccination rates among students and staff, improve community health outcomes, and increase access and equity for vaccines. For example, vaccinations provided at school-located vaccination clinics have had an impact on community spread of disease. A 2020 study showed an association between SLV coverage and decreased student absenteeism from illness and reduced influenza-related hospitalization rates for all age groups. We have a recent collaboration with the National Association of School Nurses to learn more about school-located vaccination. And in the coming months, we're going to be publishing these findings into digestible and actionable tools that you can use. In the meantime, you can find the report on the AIM website, and the link is listed there. Next slide. So just going over the role of immunization programs in supporting school-located vaccination. Partnerships are a key to success, and you're going to be hearing a lot about that today, taking pressure off of schools, school nurses who face competing demands. So the public health immunization programs are there to help coordinate some of the things that they do. They can provide vaccine, they can help with vaccinators, they can help make connections with local health departments. And there's been a lot of innovation that have grown school-located vaccination to make it more efficient, more sustainable, and some of this innovation you will hear about today. Next slide. So challenges and opportunities. So the COVID-19 pandemic has drawn attention away, I think, from some of the regular public health activities to combat influenza and other vaccine preventable diseases. Kids are falling behind on regular vaccinations. We know this, and we hope that schools will play a role, particularly now that schools are back in session, making sure that kids are vaccinated. COVID-19 really provides a unique opportunity. The infrastructure that has been built with the COVID-19 vaccination campaign can really lay the groundwork for improvements and increases and more robust school-located vaccination. For example, IT improvements, collecting consent forms electronically, scheduling and preparing clinics, reporting doses administered more quickly, enrolling tens of thousands of private providers, working with pharmacies, and having more robust relationships with communities, community-based organizations, and other stakeholders, hospitals, healthcare systems, health insurance plans. All of this has built a great infrastructure. So next slide, let me conclude by saying that, yes, we are all in this together. The ultimate goal is to keep children and families protected. And so I want to challenge each of us to see what we can do to support schools and school nurses in the community effort to vaccinate more kids, both for routine and for COVID. So I'm looking forward to the discussion today, and I'm excited to be a part of this initiative. Thanks, Mark.
Claire, thanks so much. Great working with you all on this. And now I'd like to turn to Dr. Bruce Gellen, who's the Chief of Global Public Health Strategy at the Rockefeller Foundation. He's leading work there on global vaccination, but has a tremendous history in impacting U.S. vaccination as well. Bruce, thanks so much for being with us.
Well, Mark, thanks a lot. Well, as I think many will figure out, that when Mark and Claire asked me to do this, it was a pretty easy sell. So it was great to be with all of you again today, and a chance to return to my roots on this important topic of school-located vaccination, which is one of the many topics the National Vaccine Program took on under the direction of the Assistant Secretary for Health and the range of partners both within and outside of government, the people who are assembled here today. But now I have the privilege of looking at this issue through the lens of a partner, the Rockefeller Foundation. And while I confess that a lot of this happened before I got here, that doesn't take me from taking credit for it, but really for what the Rockefeller Foundation has done. I want to tell you a few of those things and how those fit into what you're going to be talking about today. From the earliest month, Rockefeller championed this a national COVID testing plan that many of you have heard about, and to improve access to tests and treatments for all, with a specific aim of keeping schools open. And while now that we know that the demand for testing is soaring, the rates of infection, hospitalization, and death continue to climb, too much of this has continued to fall on society's most vulnerable communities. And people of color in the United States have been disproportionately impacted by this pandemic. And we still face barriers to receive COVID-19 vaccines, despite their supply and despite that they're provided by the government. And earlier this year, Rockefeller launched a $20 million Equity First Vaccination Initiative with the goal of demonstrating and scaling hyperlocal community-led programs to improve vaccine access and provide accurate information across 5 cities. In doing so, the foundation invested in localities, invested in community-based organizations with anchor organizations in Baltimore, Chicago, Houston, Newark, and Oakland, along with national organizations to adopt and then scale these learnings across the countries that we learned in these 5 cities. And by working with the people who know their communities best, big surprise, we can help to understand and remove these barriers to increase access to COVID-19 vaccinations in these communities of color and ensure that at least 90 million people of color are vaccinated by the end of the year. And by adopting this equity first approach and working with the people who know these communities best, we can increase both the access to vaccines and the confidence in vaccines and the programs we have for millions of people of color. This equity first approach was essential for schools, and Rockefeller has been doing this with schools to ensure equitable access to testing from the beginning. And now we hope to leverage this and apply it to the topic today of school-located vaccination. Just a few examples, but in Jefferson County, in Louisville and Jefferson County Public Schools started small to go big. In the spring this year, when district schools were closed, they launched small testing pilots across community learning hubs, the one place where students could gather in person to learn when their parents were unable to stay home. These small pilots enable them to iron out some of the wrinkles in small scale before offering testing across the entire district. And now they're leveraging the relationships they built here to think about and to begin to program the school-located vaccinations and testing as well. So this two-pronged approach, grounded in the trust of local communities and the partnerships and a can-do attitude, gives me hope and confidence that with our educators and leaders and all of you today, we're going to recover together and to be stronger. The person who I like to quote on this is Dr. Eva Stone from Jefferson County Public Schools, who said, "Students in, COVID out." I'm not sure that's the mantra of most schools, but it might be for this coming year. And while many schools in Kentucky are closed, schools in the county remain open. So it's a testament to proving things at a small scale. Our teachers, leaders, and school nurses are some of the best problem solvers in the nation. And this was the case, as has been the case in the pre-pandemic days, and is even more the case now. Their Herculean efforts today are what's keeping kids safe and keeping kids in schools and together. And so we owe you all for that. And thank you for being part of this pandemic response. Really, it's a movement that's focused on ensuring equitable access to quality safety measures to keep kids in school and COVID out. So again, Claire and Mark, thank you for having me. And I turn to the rest of your program and look forward to the lessons learned and the vigorous discussions you're going to have to be able to scale this and to do what you intend to do, is to provide access to vaccines in schools. Thanks.
Bruce, thank you, and thank the Rockefeller Foundation for helping to drive that schools in, COVID out movement. Great to see the progress. Still have a long way to go, but lots to build on.